medicine has become less and less about education and more about let's prescribe this medication, and it's 5 minutes of talking to the doctor. Maybe they take your pulse, listen to your heart a little bit, and boom, we'll send you off to the lab for some lab tests. They actually taught me in medical school that 90% of what's wrong with a person can be found with a good, thorough history and physical examination. That you don't have to do all these lab tests. But when I tried to interview people for a long period of time, if I took too long with my interviews of patients, then they throw a fit. Like, just, stop, because this is not a model that can make us money. We could not build all of the huge hospitals and clinics all around the country if this business model was not profitable. So it used to be medicine was more educational. I remember one day I walked into a video store and they said, we used to do all these educational videos for people all about this disease and that disease and how to take care of your diabetes and all of this. And I said, well, what happened? He goes, well, we just don't do it anymore. Doctors don't educate their patients anymore. They know a lot of this stuff, but there's no time. It's this and that, and now it's let's send them off to the lab, and let's forget what the patient says. What does the lab test say? And then now this is an epidemic of people's symptoms being dismissed by doctors. Like, they're feeling the pain, they're feeling the headaches, which is another sign of liver dysfunction. I always do liver and gallbladder cleansing when people have migraines. That gallbladder meridian goes along the side of the head. And that is definitely a sign of liver toxicity. Pain in the upper back, pain between the shoulders, pain in the right shoulder. All of this is referring to liver dysfunction.
And real quick, Dr. Foster, when you said meridians just there, I think it's so beautiful for you to maybe for 1 or 2 minutes talk about meridians. These invisible, if you will, energetic
flows.
pathways that run through our body and connect so many things together. Talk about it for a moment.
So this gallbladder meridian goes along the side of the head on both sides, and if one side is imbalanced, then you'll see like this side of the head is throbbing. You see those severe migraines. I just talked to somebody the other day, and he goes, the doctors have given me some shot in the stomach because the migraines medicines failed. And I had migraines. I had severe migraines in medical school. So I was taking migraine medication from the time I was 18. And if I had only known, that I just needed to do some liver cleansing, the liver and the colon, I clean those together with the herbs. If I had only known, I could have saved myself so much pain and suffering.
And what a double whammy you just spoke about just there. I mean, I'm thinking about your situation, which I can never imagine what you went through. The mental, emotional stress, physical stress of trying to get through medical school and what anyone might be going through, coupled with taking toxic medications. I think that alone, I've just described to millions of people that are going through so much mental and emotional stress in their lives, taking medications for whatever kind of symptoms are going on. And now they're doing more and more damage physically to their bodies. And if they could just stop for a moment, take a deep breath, and appreciate that concept alone and realize what they have to do like you did, oh my goodness, we could change an entire country's direction and how many, so many people would be taking care of themselves so differently if they realized what a deep connection there is between mental, emotional stress, and all these chemicals and how you're physically going to end up.
When I went to that holistic nurse years ago, one day she said, you have the liver of a drug addict. And I had never done recreational drugs at that point in my life.
But it got your attention.
It did, because I drank a lot of carrot juice every day and I turned bright yellow. And I could have freaked out. I had professors that noticed this. I was fluorescent yellow. One made me get checked for hepatitis, which was negative. And it was, she told me carrot juice cleans out your liver. It helps clean out your liver. And if your liver is severely toxic, you're going to turn really bright yellow. She goes, I always see this in cancer patients.
Is that, and correct me if I'm wrong, Is it just my mind's going as you're talking? Is it because the liver's toxic, right? It doesn't process it well.
Yeah,
sort of
the
like in a
carotene.
sense backs up and just reflects itself into the skin
Right.
rather than a more efficient liver where it's
Right.
like, okay, you're not so
Exactly.
orange yellow.
Yes, exactly. Yeah, and sometimes your liver is slow because your thyroid's slow, and we always see that hyperkeratinemia in low thyroid, or sometimes you see that.
And they made, I mean, you're joking around now, and I know you're way past it, but just so people really understand what it's like, maybe not everybody's gone through medical school, right?
Uh-huh.
They were making fun of you. I mean, they really were rolling their eyes at
yeah.
all this stuff.
Oh, yeah.
You would go, you said you were hiding it.
Yeah, they would call me names too, because once I turned yellow, then people were calling me Carrot Top, you know, and then my reputation would precede me into the next rotation or class I was doing. So yeah, which made me feel like I need to hide this, can't talk about it, and I was hiding in the staircases, taking supplements, all kinds of things, I took probiotics, nerve salts, I was taking CoQ10. I was taking all kinds of supplements and things, and I was putting them in my backpack every day. And I wouldn't tell anybody. At a certain point, it just was like, no, mouth shut, because I have to get through medical school and I have to survive. And it was working. So